Hi everyone, my name is Vincenzo Berghella. Welcome. Today we have Mo Mhatre, Dr. Mhatre, going over how to do an infographics on AJOG MFM submissions. I will give her the stage and disappear. And thanks for being with us again.
Thanks so much for having me. Hi, everyone. I am Mo Mhatre. I'm a maternal fetal medicine attending at Tufts Medical Center. And I'm really excited to present to you on behalf of AJOG MFM how to create an effective visual abstract. I have no financial disclosures. I do want to disclose I make visual abstracts monthly, about 4 a month, for the AJOG MFM highlights that I present with Dr. Berghella, and you can see these on YouTube. So today I'm just going to do a brief overview of some basics on visual and graphical abstracts. Primarily, what are they, why are they important, and the key points of how do you make a great one. The most important thing is that a visual abstract has to be brief. It's a single slide, high-level summary of your study. And importantly, you want to use as many icons, graphics, and images, much more than words, to convey information. And the reason that that's really helpful is that humans, in essence, we are visual learners. And, a picture is more than 1,000 words, as we all know. So in this realm of having so many articles, hundreds of articles published every day in hundreds of journals around the world, you have to make sure that your readers are actually going to read your paper. All of that hard work that you did, those amazing findings you discovered, you need to make sure someone reads them and can apply them to their practice. So the point of this is to grab the reader's attention. And studies have shown that having an effective visual abstract, especially on social media and online, have been shown to increase readership substantially. So some key points to making a visual abstract. First, you should use a template as much as you can. And I will post the template that I use for AJOG MFM, and I'll show you my example here. I recommend making a sketch if you're not familiar with making a visual abstract. It just helps lay down your thoughts of what you want to do. And I'll again show you some of my earlier examples. You want to make sure you avoid copyright images. And so I would recommend using a free icon image bank. There are several of them available online. An example of one is flaticon.com. Then you want to edit as much as you can, have other people look at it. The goal again is to make sure you edit and pare down as much as you can on your slide. And then you want to save it as a PDF, which is easy to upload and avoids kind of formatting errors that can sometimes happen if you upload a PowerPoint slide. And just check with your journal if they would prefer something else besides a PDF. This is the template that I use for AJOG MFM highlights. And the kind of key points is we want to always present in a top-down and left-to-right approach, because that is how we read in the English language. So the title is on the top. I try to use easy to read, well-rounded fonts like Calibri. Arial is also typically used. I wouldn't use something like Times New Roman in these cases. And then in the middle of the slide is the key points about your study. And again, in a left to right fashion. And I've even kind of hinted to the reader that they should be looking left to right by having the background of each section in a slightly different shade and going in a graduated fashion. But on the left, we'll have our questions or the subjects if you're reviewing a study in particular versus a meta-analysis or systematic review. The methodology should be very brief. You don't need to include your inclusion or exclusion criteria. You don't need to discuss your statistical methods, and just have a key evaluation of your intervention versus control groups. And then on your results, I would always start with the intervention group because we know we're always comparing it to the control. So again, minimizing the words you have on your screen. And you're going to have the primary endpoints. I would only include very key secondary endpoints. You don't need to include all of them. And then in bold at the bottom, in a large font, I would include the main conclusion and main takeaway that you want your reader to see very, very quickly. Include the authors at the bottom, and then in a small section on the right, I have here the AJOG MFM icon to note the journal. You can see overall, I've put the font sizes across the screen. You can see they're quite large, and that's intentional because the goal again is to force yourself to minimize the amount of words and to maximize the amount of images that you're going to use. So I'm just going to show you an example, two examples that I did. So this is for a systematic review and meta-analysis of RCTs looking at low-dose aspirin in low-risk nulliparous pregnancies. So, you know, in the regular journal, someone would have to read all of this text that you can see on the right. This was the abstract, and kind of parse through all of those words, all of those numbers, try to figure out what the authors were trying to do and what they had concluded. So now this is the sketch I had made, again, using the same template that I described to you with the title at the top. The main question, which was, does low-dose aspirin in low-risk nulliparous patients affect incidence at less than 37 weeks? I decided in my head I wanted to try to have some icons discussing a systematic review, having some way to show the number of patients involved, the intervention versus control, and then the key conclusions about the primary outcome, which was preterm delivery, and then also about hypertensive disorder, since that's often evaluated for aspirin, and then the key takeaway. And so this was my visual abstract. I had, again, the title at the top, and you can see here I was able to find these icons. These are all from flaticon.com. In addition, I found for the NICU or preterm delivery, I got a baby in an incubator. And then for hypertensive disorders, again, trying to discuss blood pressure. So kind of key images that would trigger for the reader some idea of what I was trying to describe. This was for an RCT looking at acupuncture before planned admission for induction of labor. And again, a ton of text that the reader would normally have to parse through and determine, you know, what was the study about? What did they conclude? Is this an interesting study for me to read in detail? And so I had to bring all of those abstract down to just quick visual cues. So pregnant patient, I had to randomize, just again, very simple, 106 in each group. In my mind, I sketched out either no intervention or having some acupuncture. So I imagined drawing some needles all over the pregnant patient. I wanted to show some action showing increased rates of PPROM in labor. I wanted to have something about a calendar because they had higher rates of admission before induction when you had acupuncture. I wanted to describe about the section rate and the admission to delivery time, because that's always an interesting endpoint that readers want to know, and their final conclusion. And so this is what I did for this RCT. I found a pregnant patient. This is, again, all from flaticon.com. I got a picture of acupuncture on that website as well. A pregnant patient with some action going on, which I just demonstrated with these little ticks. A calendar to talk about the admission rate before the scheduled induction. I couldn't find a scalpel, but I did find a picture of a surgeon operating, and I had a time symbol as well. And then I found at the end, put a big conclusion: acupuncture given 4 days before induction increases the rate of spontaneous labor and PROM. So key points to the reader. And that's it. I hope that this was helpful for you, and I look forward to seeing your abstract in AJOG MFM. Thanks so much.